All right. Good morning, everyone, or actually, good afternoon. I'm really excited to be here today for this bipartisan, common sense, thoughtful press conference about one of the most important issues facing not just the state of Maryland, the entire country, and frankly, the entire world. We are talking about a topic that has been a crisis that we've experienced even more intensely after the pandemic, and that is the behavioral health crisis. This Senate legislative package that we are putting forth today in a bipartisan manner is the first part of our ongoing commitment to ensure that our great state has the systems in place to provide timely and effective care to anyone who needs behavioral health help. What we have before us today are 7 Senate bills that fall into 2 distinct categories. One pillar is about improving access. The second is about modernizing our behavioral health care system. These twin pillars, improving access and modernizing the system, are foundational to a world-class health system. This is a prime example of the Senate's commitment to work together on behalf of all Marylanders. We know that solving this problem will not happen overnight. The physical health experience that most people have had, the continuum of care, is well known and has developed over hundreds of years. Now that we've thankfully reduced the stigma of the challenges of mental health, now is the time for us to rebuild the system, to be more coherent, to improve access, and to modernize. So we know this has been a policy issue for decades, and frankly, it's long before any of us got here, and in some cases, before any of us were born. But today, we are here saying that in this post-pandemic period, we are going to do what it takes in Maryland to create a world-class mental health care system. We're going to make important investments this year, and I'm so thrilled to be joined by our minority leader, our chairs, and members from the entire Senate of Maryland who recognize the importance of this issue. And without further ado, I would like to hand it over to the Senate's minority leader, Steve Hershey.
Thank you very much, Mr. President. If I could just quickly recognize we are joined by a number of Republican senators, including Senator Reedy and Senator Mounts, who are the other 2 members on the Senate Finance Committee where these bills will be heard. Behavioral health is not a partisan issue. It seems that everyone has a family member or friend who is grappling with mental health or substance use concerns. We know from decades of experience those with behavioral health conditions can and do recover and move on with their lives. But it's particularly hard to do so without assistance. This package of bills helps ensure that any Marylander struggling with a behavioral health issue can get treatment and support needed to realize the same things we all want in life: to be successful at school or work, to enjoy close relationships with family and friends, and to live a life of purpose. We have a great community of providers who are willing and able to carry out this mission. We as legislators can help by providing policies that allow and encourage flexibility and innovation in meeting the needs of kids, adults, and our seniors, and by seeking the financial resources to ensure that a qualified workforce stands ready to do the work. The Republican members of the Senate Finance Committee look forward to working with our colleagues, leadership, and stakeholders to move Maryland behavioral health system from good to great. And now I'd like to bring our chair, Senator Melanie Griffith.
Good afternoon. You know, as a social worker, I couldn't be more pleased than I am today. I'm really happy to be here and want to thank Minority Leader Hershey. I'm happy to be here with my Senate colleagues to support the Senate legislative package on behavioral health. As the Senate President noted, the Senate is committed to advancing policies that impact our behavioral health care system in the short and long term. The package we're proposing today provides both immediate solutions and long-range problem solving. We learned through the pandemic that the power of telehealth services has to reach people and expand services to those who might not have otherwise received care. Senate Bill 534 is a balanced approach to continuing Maryland's care and ensuring we have the best telehealth framework for all stakeholders. We've also seen how critical primary care providers are to total wellness. The state's collaborative care pilot program has demonstrated integrating behavioral health services in primary care settings improves clinical outcomes. This is a prime example of a responsible, short-term solution that will improve access to care for all Marylanders. As a first step to a broader approach to modernizing our behavioral health care system, we'll be testing ways to implement intensive care coordination that focuses on achieving better outcomes. Senate Bill 581 establishes a 3-year pilot program that will change the way that we approach providing complex and coordinated health care. As chair of the Finance Committee, I'll note that these bills have something in common besides their subject matter. Nearly all of the bills will come before the Senate Finance Committee. Our committee understands that we have to take actions to address the present and growing behavioral health crisis in our state. I'm grateful for the leadership of President Ferguson and the dedication of the Finance Committee members to ensuring that we focus on the best path forward. To date, we've had hearings on 3 of the bills, and the remaining 3 will come in another couple of weeks. I can say with certainty, the committee is determined to bring the best product forward to the floor, ensuring that the proposals are both thoughtful and fiscally responsible. This is more than just policy for us. We all have direct connections to the people who will be better served as a result of this legislation. We have family and friends, neighbors and constituents that we've tried to help through heartbreaking problems. I'd now like to turn it over to the Chair of Budget and Tax, Senator Guy Gazzone.
Thank you, Senator. So you got 7 bills in front of you, and we've passed one already, the 988 bill. And I'm sure you'd be wondering, well, how are we going to pay for all this? If you look at some of the numbers in these bills, and I've reviewed all of them, and I wouldn't be standing here, quite frankly, and if I didn't believe in my heart that we could achieve this package and do it in a responsible way. I actually have one of the bills, the Certified Community Behavioral Health Clinics, which we had a hearing on the other day. And in the long run, the projection on that is a pretty significant cost. But why I feel good about this is because I know that we're already serving people out in the community right now. And we're doing it in ways that are less efficient, that are more costly. We're doing it in emergency rooms and inpatient hospitals. We need to change the way we're thinking. We need to change the way we're thinking because it's better quality service, and we also believe it'll be more efficient in providing these services. There are a couple examples that we already have, because some of these bills have either been working in other states in some ways, or we've had our own pilot programs that have been going on. The Collaborative Care program has shown a return of $6 in savings for every $1 invested. And the bill that I was talking about earlier, we're finding out that it's been known to be cost neutral within 3 years. So in other words, once we get these clinics going, and this is a clinic bill, which is akin to the federally qualified centers that are already out there. When we have this operating, we see that kind of return. We see the kind of return where people are getting better care. Remember, this is for people, anybody. It doesn't matter how old you are. You can come into these systems, and it doesn't matter how you can pay, or if you can pay at all. So what I see as we move forward over time is this package producing real results in an efficient way, much better than we've done in the past. I'm really proud to be standing with everyone here today, because that's where we need to go. Thank you. You're next. Okay.
Next, we have Denise Evans, who's the president of the board for NAMI Maryland, to speak about family and consumer perspectives.
Good afternoon, everyone. Good afternoon. I'm Denise Evans. I'm the president of the board of the National Alliance for Mental Illness in Maryland. We shorten the name to NAMI. And I want to thank Senate President Ferguson for inviting NAMI here today. It's a privilege and an honor to be part of the Maryland Senate Behavioral Health Legislative Package, a set of bills that, if enacted, would provide significant relief to Marylanders with mental illness and the loved ones that support them. Together with our 11 affiliates, NAMI Maryland represents 58,000 families. There is a statistic nationwide that 1 in 5 individuals are living with mental illness at any point in time. I became associated with NAMI affiliate for Montgomery County when that happened with my family. I didn't understand it. And I will say, I fell into a class one night with NAMI, family to family. It was for the loved ones of people that have mental illness. And the skies open. And I understood what was going on. I knew I wasn't in Kansas anymore. I needed to understand what they were going through, why, what mental illness is, and understood it wasn't about me. It was about them. And I learned new tools to enable them into recovery. And I wish that for everyone. So if 1 in 5 are living with mental illness at any point in time, that would be about 780,000 Marylanders, with about 181,000 with a serious mental illness. So NAMI Maryland commends our state leaders in tackling these tough issues related to the behavioral health access, linking individuals to proper services in their community, diverting those in crisis away from costly emergency department and especially law enforcement interactions, and expanding the mental health provider workforce all across the state. We understand that the work is ongoing, and it certainly is not easy. NAMI is very supportive of the Senate's package, holistic approach to addressing current shortfalls. We are particularly enthusiastic about the package's emphasis on children and youth. One of the classes that I volunteer to teach is NAMI Basics. It is for the parents of children K through 12 who are exhibiting mental health issues. And the funds and the capacity are just incredibly important to be able to support that. The state of Maryland has been a leader in improving the lives of its citizens who live with mental illness. However, passage of these bills will continue to build upon the progress we've already made. NAMI Maryland seeks to be a strong partner in our lawmakers' endeavors to bring about these necessary changes, and is proud to be here today in support of these bills. Thank you. And next, I am bringing up Senator Hester.
Thank you very much. It's a real honor to be here today with my President Ferguson, Senate colleagues, and the advocates who have worked so hard on this issue for many, many years. I'm going to talk about Senate Bill 255, which is the Home and Community-Based Services for Children, which is one of those projects that will provide immediate relief for the mental health crisis facing our youth. As you all know, our kids are struggling, and more often than not, they wind up in the emergency room. And when it comes time to be released, they're not always going home. And that's not because their parents don't want to take them home. It's because they don't have access to that continuum of support services that would enable them to take their kids home safely. So this bill is the result of a lot of collaboration, and it's got a bit of history that I want to explain. You see, in 2014, the state of Maryland had a state-funded program that helped these children who are really at a high risk of harm or aggression with statewide coordination of support services. And at that point in time, we were helping about 300 to 400 children per year. Then in 2014, we replaced this program with Medicaid's 1915I program, which was specifically designed to help these children and to keep them out of emergency rooms. That program was designed to help approximately 200 kids per year. However, it never really worked. Between fiscal year 19 and fiscal year 21, we helped only 32 children. So what happened to all those other 300 to 400 children? They were left behind, most likely in the emergency rooms. And so clearly the program was not working. And Senate Bill 255 takes the necessary steps to improve hospital diversion and restore the balance to the children's continuum of care. It does this in 4 ways. First, there's known barriers in the 1915 utilization, both financial and medical necessity. The qualifications are too high and too stringent. We're also, the low reimbursement rates are too low for people to be able to provide these services. The second thing that the bill does is it funds high fidelity wraparound and evidence-based practices at rates that are commensurate with those industry needs, so people can actually afford to provide the services. Third, it funds targeted case management services for an additional 50 children who are currently not eligible because they do have private insurance. And finally, it funds a value-based payment pilot to treat children with intensive needs, which incentivizes outcomes such as hospital diversion and family preservation. As Senator Gazzoni said earlier, this is one of those things where if we do it right, it's incredibly cost-effective. For example, in the year 2021, the 1915 I program cost just $2,500 per child, but it wasn't used. Instead, when the children wound up in the hospital, it cost $26,000 per child, or when they wound up in residential treatment, it cost $77,000 per child. So by investing in this program, we'll be actually delivering more services, keeping kids out of hospitals, and saving money in the long run. I'd like to thank my Senate colleagues and the advocates today for being here, and I'd be happy to answer questions later. Thank you so much.
Next, we have Dan Martin of the Maryland Behavioral Health Coalition.
Thank you, Mr. President. Dan Martin, here with the Mental Health Association of Maryland, but like you said, representing the Maryland Behavioral Health Coalition, which comprises nearly 100 nonprofit organizations representing consumer and family advocacy organizations, peer-led groups, community providers, professional associations, hospitals, health systems, and more. And I want to thank Senate President Ferguson and this bipartisan group of Senate champions behind me for prioritizing this issue and taking steps to really address the growing demand for mental health and substance use treatment across our state. We've done a really great job over the past few years building out our behavioral health crisis response system, and thank you again to the Senate for making expansion of 988 the first bill that you passed this session. We need to make sure people experiencing a behavioral health crisis have the resources and support they need. But the fact is, nobody wants their first interaction with the behavioral health system to be when they're in crisis. We don't do that in other areas of healthcare. We don't tell people to wait until you have a heart attack before we can start addressing your high blood pressure. But that's exactly what we do with mental illness and behavioral health, and it ends up killing us, literally and figuratively, in lost lives, expensive emergency department visits, et cetera. And so we really need to get upstream and focus on preventive interventions that can keep people out of crisis, and that's exactly what this package does. The collaborative care model improves the quality of behavioral health services delivered in primary care settings, which is where most people with mild to moderate depression, anxiety, and the like first go to seek care. CCBHCs are specially designed programs to provide a comprehensive range of outpatient mental health and substance use treatment in the community, care coordination, care for veterans, peer and family supports, et cetera. High-fidelity wraparound services is the gold standard in treating youth with high-intensity behavioral health needs in their homes and in their communities. Value-based purchasing ensures we're focusing on patient-centered care and reimbursing for outcomes, not the volume of services delivered. And the Telehealth Access Act extends flexibilities to ensure we're able to provide people with behavioral health services when they need it, where they need it, and how they need it. And so this is a package of proven reforms that will improve behavioral health outcomes, reduce unnecessary and costly hospitalizations, keep people out of crisis, and save lives ultimately. And so again, I just want to thank you very much for your leadership, and thank you to all the senators for supporting these priorities. Thank you.
Finally, we have our Senate President Pro Tem, Malcolm Augustine.
Thank you, President Ferguson. Folks, Marylanders are hurting with regard to their mental health and wellness, and as you can see, we are committed to doing something about it with our policy and our budget. Just to give some context for me and how I kind of come to this, some years ago, I was getting my oil changed. It's like an odd situation, right? And there was a customer service person who was there who seemed to be pretty upbeat. You know, most times they're not that upbeat, quite honestly. But this guy was particularly upbeat. And I asked him, like, you know, kind of like, what's going on? Why are you so upbeat? And what he shared with me was that he was given a second chance. He had recently come out of prison and was just really grateful to have this job that he had. And then we started to talk about, well, what kind of got you here? And he was able to pinpoint for me what had happened in his life that had him go through this entire experience. What he said to me was that when he was about 10 years old, his brother died in an accident, really a terrible accident. And when this happened to him and to his family, it was very traumatic, very, very traumatic situation for him. And he realized then, coming out of this trauma, which nobody did anything, no care for it or anything else, he started to develop real anxiety. He started to develop depression around this, and he tried to self-medicate, got involved in substance use, and it ended up becoming substance abuse over time. And then that turned into violence and violent behavior when he was involved in this substance, impaired state. And that activity ended him up in prison, incarcerated. And it was a 20-year struggle for him in there. And sadly, which is what happens for a lot of folks, even though it was good that this occurred, he finally started to receive some behavioral health services when he was incarcerated. And to the point where he was able to sort of rebuild. Now, the good news is with that, which of course what we know, is that there is recovery. There are good answers for us with regard to mental health and mental illness. But why should we have to go through 20 years incarceration, years lost for people, when we can do something about it right now? And that's what this is all about. This is about us making a change early with proven methods that can really benefit the people of Maryland. As Dan Martin said, if you got a broken leg, you got a crisis like that, could you imagine would we just walk past somebody if they were walking around with a broken leg? We wouldn't do that. We would immediately work to get them the care that they need. And that's what this is talking about here. Now, these pieces of legislation that were so beautifully laid out today, proven, cost-effective ways to help Marylanders live these full lives when they're working with this underlying mental health and mental illness and substance use conditions, to avoid some of these heart-wrenching stories that we know and have heard about. Now, this is complicated. I will say that. It's complicated. Our system of care is complicated. And a piece of legislation that I'm working on, Senate Bill 582, establishes a commission on behavioral health. And that commission will look at appropriate, accessible, and comprehensive behavioral health services for all the individuals of our state. Because comprehensive improvement in our system of behavioral health is a top priority, as you can see, of the Senate, of all these legislators who are assembled here, in addition to all of our other colleagues who are committed to doing the long, hard work of assessing, implementing, and monitoring mental health care in our state that helps Marylanders live the full lives that we all want for each other. Thank you.
Questions? Please.
Mr. President, a lot of you have talked about an emphasis on hospital diversion during this presentation. Will any of the bills actually support those who need inpatient treatment?
Will any of the bills support? Let me, on the specific, we are very fortunate in the state of Maryland to have some of the best inpatient treatment on the globe with institutions like Sheppard Pratt and Hopkins in Maryland. We have some of the best providers in the world. I think the key to this package is that we are trying to reduce the number of crises that get to that point. That is really, we're trying to improve access and modernize the system so that we have less who are having to wait to get services until the point that they are experiencing that crisis. I don't believe we don't have a specific, is there?
No, I would just say that the package is largely focused on just what the president was saying, which is avoiding those costly emergency room visits and inpatient care by providing care at the first most reasonable point of access, which is usually the community provider. One of the bills has patients getting assessed and contacted in their primary provider's office, which is where some needs are identified. And the majority of the bills are the community setting, using well-trained community providers that know these patients and can help best meet their needs in the community so that they can be at home and continue to work and have a quality of life.
I'd add too, in Senate President Pro Tem's bill is the commission to look at this in the long run. And so all of these pieces are complex. And so while we're really focused on these specific bills on the front end and reducing the number of crises, making sure that we have the best crisis care is essential. And that's why the commission bill is a part of this package as well.
Mr. President, I'd like to preface this by saying we can't afford not to do this. The package of bills probably will pay for itself. Can the state budget absorb the cost, and for how long until they start paying for themselves?
Dave, you just totally answered the question. No, we can't afford not to. And I think we're seeing the cost of untreated care. We're seeing the cost of relying on the crisis to be the first point of impact and first point of treatment. It is crushing our systems. And we're seeing people who are stuck in the hospital at the most expensive care point through the system. And so if we can get earlier access sooner, we save money in the long run. This package is roughly, in the aggregate as drafted, somewhere in the neighborhood of $35 million a year. But as we go through the legislative process, we know that we have the resources, as the chairman of the Budget and Tax mentioned, and those are the immediate costs for these programs, but that does not include the cost savings that will absolutely for sure occur should we move forward and effectively implement these programs.
Mr. President, you talked about creating a system, and I'm wondering if you have anything within this package that would address, like, how will you have the workers, how you have the providers, how you have the doctors? I mean, we hear from primary care physicians that they don't have somebody they can refer someone to who has current openings. And, I know somebody talked about it's kind of akin to federally qualified healthcare centers, but we also can't find physicians to work in those. So how are you handling that?
So as a part of Senate Bill 582, one of the things that will be assessed for certain is the workforce. It's an important part of that total assessment of where we are. And so that's definitely going to cover that for sure as a part of it. The other part that my colleague mentioned is the collaborative care model as well, which of course does provide for an opportunity to bring behavioral health specialists closer to our primary care environment. It also is going to provide an opportunity for us to reimburse, which is always very important, that we also show with our budget that we think that this is an important thing. And so that's what we're looking to do with that piece of legislation.
Will any of the measures create clinics around the state? Someone say that earlier. How many are we talking about?
So that actually talks to one of probably the biggest long-term expenses, which in turn also will lead to the biggest savings. And yes, the bill that I was talking about, the certified, this is the worst acronym in the world, CCBHCs. So we have had essentially a pilot program going for a while. And that's why we have some data about how successful they are. We have 5 of them operating right now in the state. They're under a grant program. The problem is that grant program isn't guaranteed forever, and that's why it's important that we move forward with this legislation. Ultimately, we want to put them in every community across the state. And so there is some upfront cost. The point that I would make is that we're going to do it in a reasonable manner. We're going to be working with the administration. Within the bill, it allows the administration to bring these online as they see fit, as they are appropriate. Ultimately, though, hopefully all across the state, there will be significant Medicaid match dollars involved in that process. But again, as they come up and run, they will turn around and be more efficient and end up saving us more money in the long run.
This might be for Chair Ghisoni or the Senate President, but you guys talked about viewing these bills as like a holistic package and doing them as part of the overall state budget plan. What is your level of collaboration or buy-in with the House of Delegates and with the governor's office?
Yeah, sure. We are in close communication. A number of these bills are cross-filed, and there's great interest in the House. We'll work very closely. I think we stand here as a bipartisan coalition in the Senate because I think we really want to send the message to Marylanders that the challenges that we face with mental health are not Republican issues, they're not Democratic issues, they're Maryland issues. And this is a crisis in a post-pandemic period that we stand here together, arm in arm, figuring out how we can put solutions out the door and help communities and families feel more stable and feel like they have the ability to thrive. So that's the message here, and this is important for the Senate that we demonstrate that we solve problems. That's what we are focused on doing, and that's why we're here together today.
We have time for one more, guys.
How would you put this in perspective, this package, with previous efforts to address mental health? It sounds like this is a rather large-scale effort. I mean, how does it compare to past efforts?
You know, this is not a problem that has not been attempted to be tackled previously. The challenge is it's complex, and I think we are experiencing a moment in time where there is a greater recognition of the importance of physical health and mental health collaboratively being addressed together and seen as an equal playing field. And so, you know, what we have to do now is provide the things that we know have evidence that will work. That's what a number of these bills, and put together the commission that will give us a long-term pathway of what a coherent, full, modern healthcare system that focuses on mental health and physical health equally can look like. So, you know, I think that it's short and long-term access and modernization.
Thank you, Mr. President. Thank you, guys.
Thank you all.
Good job.